So I'm here at St James's Park in Newcastle for our 24-hour posture conference, and I'm delighted to be sitting with Michael Kerr, or Dr. Michael Kerr. Do you like to be known as, Michael?
I don't like to be known as doctor, no. I think Norma's the only person that calls me doctor.
Well, very good. So anyway, Michael, I'll just call you Michael then. So thank you so much for agreeing to take part in the podcast, but you also spoke very well for our conference here today, and we want to thank you for that because you're very honest, very courageous and very open about your disability. So for those listening who are not viewing this, can you tell us a little bit about your history, about how you came to be a wheelchair user?
Yeah, so back in 2000, I went on holiday to Cavos, Corfu, a boys' holiday. While I was there, 4 days into the holiday, I dived into a swimming pool. Didn't realise the end of the swimming pool that I dived into was a shallow end. Hit my head in the bottom and broke my neck. Sustained a spinal cord injury at C6. Complete paralysis from the chest down.
So what age were you then, Michael?
I was 17, just about to turn 18. 17. So it was 2 months before my 18th birthday.
And how did you cope with that at that time?
Well, I think I coped pretty well because I think I knew as soon as I dived into the swimming pool what I had done. So before I had my accident, I was studying health and fitness at college. So I was pretty clued up on the human body and the anatomy and all that. So I think as soon as I done it, I realised what I had done, so I accepted it pretty quickly, I think.
Goodness, that was very good. A big life-changing event, obviously, to say the least, at 18 or almost 18. So you came back home and you spent, how many months did you say, about 9?
So 10 months.
10 months
in the spinal unit in Glasgow. So I was like 2 weeks or something in high dependency, and then the rest of the time in the rehab ward, obviously getting rehabbed, learning to do everything for myself again.
And did you have a lot of input from physio and occupational therapists?
Yeah, so physio twice a day while you're in rehab, occupational therapy, hand therapy as well. Obviously learning how to use my hands and that again. Obviously because of my level injury, my hands are affected.
Yeah, so that's what I was going to say. So it's a C6 or C7?
C6.
C6.
Yeah, so C6.
So for people who wouldn't be familiar with a C6 injury, what does that involve for you?
So C6 injury affects, so I'm actually sort of lopsided, if you like. So my right side is stronger than my left. I was right side dominant before my accident anyway, but the way my level is, I'm stronger on the right than I am on the left. So my triceps on my left side are affected, so they're not at full strength, but on the right side they're at full strength.
Very good.
My hands are affected, so I don't have grip in my hands, I don't have any grip, don't have any like fine dexterity, fine motor skills with my hands.
But you have some function there.
It's more like tenodesis grip, if that makes sense. So when I flex my wrist, my fingers and my grip comes in my hand, but without that I don't really have any much movement, any grip at all really. But you just learn to adapt, obviously it's been 26 years. You just learn to adapt to what you've got.
So after your rehabilitation, I don't know how long it was, but you became interested in rugby, wheelchair rugby.
Yes.
So how did you build up the strength for that?
Well, that was actually the reason why I started playing wheelchair rugby. So, like I said, I touched on before, I was studying health and fitness in college. So I was only ever really interested in sport, only ever really good at sport. So while I was going through rehab in the spinal unit, I found out about wheelchair rugby. When I was discharged from the spinal unit, I went along only to get fit and healthy and strong again. And then obviously I enjoyed it. because it was sport, I could continue to play sport. I then got good at the game and quickly realised that it was what I wanted to obviously dedicate my time to and be my main focus, if that makes sense.
Did that help you mentally as well to
Absolutely.
have, as would have been a big thing for you?
Massive. If it wasn't for wheelchair rugby, I wouldn't be where now. Like I've got wheelchair rugby to thank for everything that I've achieved in my life, everything that I've done, where I've got to, being independent. If I didn't start playing rugby, I wouldn't be independent. I wouldn't have met the people that I've met. I wouldn't have opened the doors that it's opened. Got to travel the world playing that sport I loved. So
Well, tell us your achievements, because there have been many in wheelchair rugby. Tell us about your achievements.
So obviously I represented Great Britain for over 10 years. I competed at 3 European Championships where I won bronze, silver, gold.
Excellent.
I competed at a World Championships. I captained the team at the World Championships. And I competed at 2 Paralympics, London and Rio. I was vice captain of the team at London.
And did I read somewhere that you carried the Olympic flame as well?
I carried the Olympic torch.
In London?
On the lead up to London. I carried the torch in Glasgow, but it was in the lead up to the London Games.
Very good.
I was awarded an honorary doctorate for my achievements in sport. I was inducted into the Hall of Fame. So it's been quite.
So it's been a really successful career for you, really, hasn't it?
Absolutely.
So did you, since you retired from that, now you're still working full time?
Not at the moment.
You were after that?
I was after that. So, well, it was part-time first, when I started working for a company called Wellspect Healthcare.
Well spent?
Wellspect.
Oh, Wellspect.
So they manufacture intermittent catheters.
Oh, right.
So they manufacture the low-fric intermittent catheter. And because I'm an end user of intermittent catheters, I became an ambassador for them. And then I got into the mobility industry, working for a company called Cyclone Mobility, who do custom-made wheelchairs.
And was that an advisory and sales, or what sort of capacity
like a
was that
sales
in?
mobility advisor role, so obviously advising people, measuring people up.
Good.
For chairs, also electrical add-ons like bikes and rear add-ons. And then I was working for a mobility company in Scotland called Albion Mobility, doing the same thing.
Albion?
Albion Mobility.
Oh, I knew that. So you talked earlier when you were doing the presentations about getting this pressure injury and having to stay in bed for 6 months. Tell us about how, first of all, you got it, and how you were saying about how quick it developed, because I think that's important for people, not just wheelchair users, but also for clinicians to know that these things don't take a long time to happen.
No, they don't. So when I got my pressure injury, it was due to changing my chair. So I changed my chair from a chair with a flat seat to a chair with what's called an ergonomic seat. So when I changed chairs, the cushion that I was using, I think it was a J2 at the time. The J2 didn't shape into the ergo seat properly. So basically all the gel in the J2 was just pushing at the back of the chair, and the cushion was bottoming out. So I was basically just sitting in a hollow, just on the solid base part of the cushion.
And how long was it from you started using the new cushion until the pressure injury occurred?
Probably not that long, maybe only a matter of months. Was
there no regular check? Because that'll be very important for you. Do you get them now? Do you get regular chin skin inspections now?
No, so I just do it myself. So
You just do it yourself?
Up to myself to obviously check my skin and stuff like that.
Right, so you're not getting those. And would you advocate that's such an important part of your overall care now?
Yeah, absolutely massive. I mean, I check my skin twice a day, morning and night. Like, very meticulous as well. We like cutting labels off stuff and that. Any wee thing that you think would cause pressure, do you know what I mean? Where it shouldn't be really. I'm quite like meticulous with that, cutting labels and stuff off and making sure you're not sitting on seams and all that sort of stuff.
And that 6 months that you had to spend, I mean, that must have been a really challenging time. How did you get through that?
I think I got through it because I'm quite strong-minded. I'm quite a strong-minded person at the best of times, but like I'm not saying for any, like I'm not saying like it was easy. It wasn't easy.
It wasn't
obviously,
easy.
but I've got good family and friends round about me, so that obviously helped. But no, it definitely wasn't easy, especially when you're used to being so active.
Because you went from being so active, like it was almost complete. And was it during that very active time of your career that this happened?
So I was working, no during my...
Not during your rugby time, but during your full-time work?
But during my working time, so I basically went from working to bang, nothing. Like, laid up completely, 24/7 for a solid 6 months. Like,
that's a huge challenge.
Huge challenge. It affects your mental health, do you know what I mean? Like I touched on when I was talking earlier as well, you've got bowel care to think about, bladder care to think about, so there's so many other things that go along with it. It's not just the fact that you've got a sore.
So Michael, during that time, did you have carers there? Did you have people around you, or how did you manage that whole period of time?
I didn't have carers as such, but I had family, like my mum, other family members and my friends were obviously helping me, but no carers as such as outside care, but family and friends.
We talked about the pressure injury you had in your sacral area and you were in bed rest for 6 months, but you also had a previous one on the back of your head. That was quite severe, wasn't it?
It was, aye. If I just turn around, I can show you where the scar is, if you can see it at the back there.
Yeah.
So
was that at the early stage of your treatment that happened?
So I got that pressure sore when I was still in high dependency in the spinal unit. I don't know obviously how it first started, but nobody noticed it.
Right.
And it was me kept complaining with the pain, and I could also feel stuff like running down the back of my neck, and I kept saying to them like there's something not right, and then finally they did notice that the skin was broke, but it was quite bad.
That would have taken a long time to heal. Was that a grade 3, grade 4?
I'm sure it was a grade 4. It did take a long time to heal. Like they had a vac, a vac and all sorts of healing aids on it, but nothing really worked.
No.
The only way they could get it to heal was dressing it and putting like a bandage like round my head to keep the dressing on, obviously because of the hair. It was hard to get things to stick. And
would that still be an area that would be like sensitive, or you'd need to be careful with even yet?
No, it's generally alright.
You don't feel any
sunburn really is the only thing, like you really need to watch it, keeping the sun and stuff. But no, I don't really notice it. I always forget it's there. Obviously, out of sight, out of mind kind of thing. Right. It's not until somebody mentions it.
It's funny how, like nursing and that, be looking for pressure injuries in the sacrum and the heels and all. Never thought of looking on the back of your head.
No. And they're actually quite common as well. You see quite a lot of people.
I've had a patient as well with one.
Spinal injuries with pressure sores in the back of their head.
So what are you doing now to maintain your strength and your body and your skin? Are you doing anything? Do you go to the gym?
I do, not as regularly as what I probably should. I'm still at the gym on and off and still doing different things like that. I competed in a fitness competition, but I can't remember the name of it actually.
That's alright. I forget the name of things all the time.
Which I won for my classification.
Very good.
So I'm still keeping my hand in sport to like a certain extent, not as much as I used to. But I've just got other things going on in life now.
So what sort of things are you doing, just to finish off? Like what sort of things for the future? What's your plans, or have you got goals that you want to achieve, or things that you want to do? Or
again, just obviously keep my hand in sport, like keep fit, keep healthy, that sort of stuff. Probably back to work, but not in a full-time capacity, probably just part-time. But probably more sort of as and when it suits me. No like a 9 to 5 for a company or anything like that anymore. I think I've done enough of that.
Yeah. I think you'd be a good advocate and spokesperson for people, wheelchair users or people with disability. Do you do much of that, or that would be something that you definitely other people would benefit from?
Yeah, I mean, it's something that I would be interested in. I do, like I say, bits and pieces like that, do you know what I mean? And it's probably something that I would like to get involved in more. So yeah, like things like that, I'm always open to. If I can pass on, like obviously help and
to other people,
experiences to other people, then absolutely.
Because unfortunately these things are happening, and there's young people out there that need somebody like you that's going to inspire them and give them hope.
Well,
that
absolutely.
There's still a future.
And I think also more so in this day and age, like I think the current situation we're in at the moment with the NHS being stretched to capacity, social care system being stretched, I think there's even more need for it now than there's probably ever been, to be honest.
That's right. Well, Michael, I want to thank you, and there's been a lot of noise while we were recording this because, as we said earlier, we're in St James's Park here in Newcastle, and I think they're renovating the stadium for the new season. So anybody listening, the noise was not us. But thank you so much, Michael, for taking part, and thank you for coming today to talk to the conference. It was really appreciated.
well.
No problem.
Thank you.